In this video, we are going to deal with the presenting parts of the heart. Before going into the topic, let's get oriented with this image. This is the anterior view of the heart and its associated great vessels. So this is the subclavian veins, both left and right subclavian veins. These are the internal jugular veins, left and right. And internal jugular and subclavian join to form the brachiocephalic veins, right and left. Two brachiocephalic veins join to form the superior vena cava, which is entering into the right atrium. And in this picture, in this view, we can see the aorta along with aortic arch, origin of the aorta, ascending aorta and aortic arch, and we can see the pulmonary trunk also. The heart presents mainly apex, base and three surfaces and three borders in between them. We will deal with one by one. First one is apex. So this is the apex. It is a conical area formed only by the left ventricle. Next is the base. So if you look at the base, it's in the posterior aspect. So now the base is bounded above by the bifurcation of the pulmonary trunk, below by the posterior part of the atrioventricular groove containing coronary sinus, and the right side, right border of the right atrium extending from the superior to inferior vena cava orifices. On the left side, left border of the left atrium. And now come to the right border. We will see from here on in the anterior, we'll identify these borders from the anterior view of the heart. So this is the right border. It is rounded and convex, formed only by the right atrium, and extends from the right side of the opening of superior vena cava to that of the inferior vena cava. A shallow vertical groove that is known as the sulcus terminalis accompanies the right border. Next one is the inferior border. Here is the inferior border. It is sharp and it separates the sternocostal surface from the diaphragmatic surface. This border is accompanied by the marginal branch of the right coronary artery and its corresponding vein, the artery in red color and vein in blue color. Next, about the left border. So there is an ill-defined convex border and it extends from the left auricle to the apex of the heart with the convexity directed upwards and to the left. Now coming to the sternocostal surface, it is directed forwards and upwards, and this surface is separated from the base by the right border, from the diaphragmatic surface by inferior border, and from the left surface by the left border. And we can see the following parts of the heart in this surface. 1. Anterior surface of right atrium and its auricle, a part of anterior surface of left auricle, anterior surface of right ventricle, and anterior surface of the left ventricle. The right ventricle, anterior surface of the right ventricle forms 2/3 of the surface, and that of the left ventricle forms the 1/3 of the surface. In this surface, in the sternocostal surface, we can see the anterior part of atrioventricular groove, which lodges the trunk of the right coronary artery, and it is crossed by the anterior cardiac veins. Anterior interventricular groove. Next one is the anterior interventricular groove that passes downwards and parallel to the left border of the heart, and they meets the inferior border at the lower part. Now this groove lodges anterior interventricular branch of the left coronary artery and great cardiac vein. Next come to the diaphragmatic or inferior surface. So diaphragm is in the inferior part, so we can see from the inferior aspect. So this is the diaphragmatic or inferior surface. It is found only by the two ventricles, 2/3 by the left ventricle and 1/3 by the right ventricle. We can see the posterior interventricular groove in this surface, which lodges posterior interventricular branch of the right coronary artery, middle cardiac vein, and the anastomos of interventricular branches of both coronary arteries. Now come to the left surface. So here you can see the left surface, which is partly formed by the left atrium and its auricle, and mainly formed by the left ventricle. So the left part of the atrioventricular groove intervenes between left auricle and left ventricle, and they load the following structures: the trunk and circumflex branch of left coronary artery, termination of the great cardiac vein, and commencement of coronary sinus. Hope the video was useful. Thank you.